Hi, I'm Vivian Lamb, and I am the clinical manager at Laser and Skin Surgery Center of Indiana, and I assist Dr. Hankey with tumescent liposuction. So tumescent liposuction is a candidate-based procedure that Dr. Hankey determines when a patient has a cosmetic consult here at the office. Once Dr. Hankey determines that the patient is a candidate for the tumescent liposuction, then we give the patient a folder, and within that folder there's pre-op, post-op sheets, consent forms. There's also a lab panel that needs to be done 2 weeks prior to the procedure, and also there is a EKG for patients that are 50 or older that needs to have that done as well. So once the patient is approved for the tumescent liposuction and they are scheduled and they're here for their procedure, we take them back to the operating area where the procedure will be done, and we take pre-op vitals. We also will then get Dr. Hankey in to the room, and he will then mark the areas that he will be treating that day. The patient will then be given the opportunity to take an anti-anxiety medication, and they can opt if they do not want to take it. The patient does have to have a consented driver with them present before we start the procedure, as well as before the patient leaves once the procedure is done. So the procedure is done under local anesthetic, and it is infiltrated into multiple areas that Dr. Hankey chooses when he is marking out the area for treatment that day. The nurses, myself, and the other assistants will be infiltrating the tumescent liposuction to the patient. Once the area is completely numb, then we have Dr. Hankey come back and the procedure will then start. The patient will then follow up with Dr. Hankey in 1 week. We place follow-up calls. The patient can call us if they have any questions or concerns about anything. Once the patient comes back in the week, we advise the patient that they may have minimal bruising, some swelling that can last for the next several weeks, up to the next several months. It can take 6 months to a year to see your final result.